and I'm honored today to be joined by a panel of experts who will be sharing with us not only how the pandemic have impacted American Muslims, but how American Muslims have reacted to the pandemic, what they have done, and how that's hopefully changing things in our community and our organizations for the better in the future. So today's conversation is, as I mentioned, this is before I get into the specifics of this conversation, just a little background on who we are. ISPU is a research organization that have been around for close to 20 years. And our objective or our goal, our mission is to provide objective research and education of American Muslims to support well-informed dialogue and decision-making. And because this is our mission, the pandemic actually have changed how we handle this specific research project. Most of the time, our research projects are done, we field the surveys, we analyze the data, we review them, write the report, and about a year or 18 months later, we publish a full report on a specific study. But because we want to inform decisions and inform the dialogues, whether within the American Muslim community or at large, we changed how we release reporting on the specific survey because we realized a lot of the data is extremely timely and needed and missing from the larger society. So instead of releasing a full report at the end, which would have taken us a lot longer, we are releasing specific sections as they are very relevant. So we started with information on the vaccine. Because this conversation is ongoing and information is needed, we released that a few weeks ago. And as of yesterday, we released a second piece on masking and attitudes toward masking. And we have a few more pieces in the pipeline that will talk about the impact of COVID-19 on American Muslims, contributions of American Muslims, trust of authority figures, and so on and so forth. So the pandemic have changed how we handled this specific project, just like it changed a lot of things in other organizations. Who is the American Muslim community? I will share just 2 points because it's very relevant to the conversation and to the data I'm sharing today. American Muslims are the youngest faith community in the nation. You'll see here that 23% of American Muslims are between the age of 18 and 24. This is relevant to both the vaccine and the masking attitudes. It's also the most ethnically diverse faith community, where 28% of American Muslims are African American or Black. That's how they identify. 14% identify as Arab, 8% identify as Hispanic, 19% as white, and then 23% as Asian. I want you to keep all of that in mind as we share some of the data today, and also as you think of all the different conversations that have happened around COVID-19, how it impacts different communities, whether racially or ethnically or socioeconomic or age group. And then one more background information is American Muslims are also most likely to report low income. And we know the pandemic have hit low income communities harder. So 35% of American Muslims report low income status. On the other hand, we have a disproportionate number of American Muslims who are at the front line, especially in the health field. So as an example, we have in Michigan where less than 3% of Michiganders are Muslims. They make up 15% of the medical doctors in that state. And it's one of the states that was hit hardest by COVID-19. Similarly, in New York City, where the population or the Muslim population is less than 9%, they make up 10% of the medical doctors. So they're both on the low income end of socioeconomic status, but they're also part of the frontline workers who have not had a break yet during this pandemic. So Community in the Time of Corona is a project we actually launched in 2 phases. The first phase was launched right at the beginning of the pandemic in March of 2020. We launched a Google survey. We're asking people how COVID have impacted them and what are they doing to contribute or to address the need in their communities. And so that report is available on our website, ispu.org. The second report is an actual survey, Qualtrics survey that was fielded between March 22nd and April 8th of this year, 2021. Keep that date in mind as we share the results, because that's the time when most of the community still had mask mandates. Vaccines was not widely available to the public. It was still being administered in different phases. And so it's in that background that the results that we have today were gathered. So when it comes to vaccine, American Muslims are slightly more likely than the general public to be hesitant, to express hesitation toward vaccine. Only 35% said they will get the vaccine as soon as they can. While in 17% compared to 13% in the general public said they definitely are not getting vaccinated. Some have expressed that they will wait until others have gotten vaccinated or it has been around for a while. I know some of my family members were in that category. And 11% said they'll get it only if it's mandated by their employer or by their school. Muslim women were more hesitant, expressed more hesitation. There's a lot of reasons, and I'm sure our panelists will express on that a little bit. But compared to Muslim men, Muslim women were more hesitant to get the vaccine. Only 29% compared to 41% among men said they will get the vaccine as soon as they can. 19% of Muslim women compared to 14% among Muslim men said they are definitely not getting vaccinated. When it came to receiving the vaccine, if it's mandated or they have received at least one, the numbers were similar between men and women. Young Muslims, remember that's a very large segment of the American Muslim community, are the least likely to receive the vaccine by April of 2021. Remember at that point, it was still not widely available to everyone. So only 11% at that point have received the vaccine. But they were also the more likely to be hesitant. So that age group was more hesitant about receiving the vaccine when it became available to their age group. So 28% of those 18 to 29 compared to 16% among 50 years and older said they will get the vaccine as soon as it's available to their age group. And then a quarter of older Muslim of older Muslims said they're definitely not getting the vaccine. So 26% of Muslims who are 50 years and older said they are not, or they do not intend to get a vaccine. More than a third of Black Muslims said they do not intend to get a vaccine. Again, keep that in mind as we discussed earlier, the ethnic makeup and the racial makeup of the American Muslim community. So vaccines is one topic. The second one is if you're not getting vaccinated or have not been vaccinated, the alternative is for people to continue to mask because that's a second layer of protection, or that protection for them and for others. So the attitudes here among American Muslims is, one, among Americans of all backgrounds, including American Muslims, the vast majority said they always wore masks. So 82% said they always wore masks. 3% in the general public, and only 1% among American Muslims said they never wore a mask. Those who identified as very liberal, self-identified as very liberal among American Muslims, compared to very conservative, self-identification of very conservative, very liberal were more likely to wear the mask, at all times. So 93 compared to 83 among very conservative. And then again, young Muslims were less likely than older Muslims to always wear a mask. So they were more vaccine hesitant, and they also were less likely to wear the mask in public places. Only 79% among those 18 to 29 versus 86% among 50 years and older said they wore the mask. They always wore the mask. On the other hand, you have Muslims Muslims were more likely to support mask mandates. 81% compared to 74 in the general public said that that mandates were a reasonable measure to protect the public, as opposed to seeing it as an unreasonable attempt to control people. And then the other view is 81% of American Muslims compared to 75% in the general public said that the pandemic could have been handled better. So this is the data that we have from this report. As I mentioned, we will have a lot more data on the impact of COVID-19, those who have tested positive, those who have lost someone to the pandemic, those who have lost relationships or jobs or things like that. There's a lot more coming on from this report that will be released over the next few weeks. But we wanted to share this with you today and do a year and a half kind of report on what has been going on, where is the community today, and what could be done in the future based on the lessons learned from this pandemic and from the things that took place during this pandemic. So I am honored to be joined by a panel of experts who will be helping us understand a little bit better all the things that I mentioned in my presentation. I want to introduce our panelists very quickly, and then we will have them one at a time kind of give us a report out, and we'll have a time for Q&A from the audience at the end of this panel. So please continue to use the Q&A box to add your questions there. So I'm joined today by Dr. Muna Masood. Full bios will be shared in the chat box, but Dr. Muna Masood is an outpatient psychiatrist in the greater Philadelphia area and a board member of a nonprofit community mental health organization called Muslim Wellness Foundation, which provide mental health and education services in the community. She's also the founder and the chief organizer of the Physician Support Line, which I'm sure she will talk about today. I'm also joined by Dr. Ghada Khan, who has nearly 15 years of experience as a public health professional, a community-based researcher, a professor with a demonstrated history of working in government, nonprofit, and academia, at state, federal, and international level. Dr. Khan currently serves as the executive director of the American Muslim Health Professionals and teaching faculty member of the George Washington University Malik Institute of School of Public Health. And then finally, I am joined by Dr. Malik, who is an assistant professor at Stony Brook University School of Social Welfare and has served as a consultant for various health and social service agencies, including the UNHCR. Dr. Malik has awarded a U.S. Fulbright Fellowship in Jordan and completed her doctorate in public health from Johns Hopkins University. She's also an ISPU scholar. So welcome to all of you. Thank you for joining me today. I'm going to start with you, Dr. Muna. So, as I mentioned, a year and a half into this pandemic, can you give us a mental health report on the general public, American Muslims, and of course, frontline workers who are the health workers?
Assalamu alaikum, everyone. I'm really humbled and honored to be a part of ISPU's panel today, and I've just been generally working with them on various topics, especially about mental health in the Muslim community during this pandemic. So mental health is a very, very broad topic, and there is no doubt that it has been severely impacted during this pandemic. I've been seeing from our attendees today that we have a wide range of ages that are attending, and we already received a question, which I guess I can start there. Is mental health, I think, has definitely affected everyone on different levels. I specifically focus on physician mental health during this pandemic because of the impact that they have had for a year and a half of ongoing trauma and of dealing with so much death and grief and loss of life during this pandemic. So that has been a particular focus. However, in general, I can start with teenagers and with youth, which is a lot of the patients that I see in my clinical work and in the community, is that isolation during this pandemic has been an incredible impact on mental health. And for youth, it's been interesting to witness, and it's been sad to witness, really, because because of virtual schooling and being taken away from their peers and their mentors, their teachers, their community, we really got to see, um, we really witnessed some deterioration in their development. Um, Teen years, the main thing that is psychologically appropriate and is a part of their development during this time is a sense of identity. And when we think about sense of identity, we often think of it as, oh, it must come from self-reflection. It must come from doing, a lot of insight and questioning of ourselves. But truly, a sense of identity comes from, our interactions with others. And that was something that was missing for our youth during this pandemic. And for youth, sense of identity doesn't even come from parents and from adults. It actually comes from peers. There is a lot of influence, good and bad, that comes from peer interactions. But for teens, that is essentially where they, begin and end this kind of psychological development. They find what they identify with their core groups. They find where they fit in. They find where they don't fit, and that they find themselves their own unique qualities and interests. But without that kind of environment in that community, there's really not a way to do this trial and error, which is inherent in our psychological development. So I saw a lot of teens feeling more lost, and those would be their words, and how they described what they wanted, their goals, their futures, because they didn't really have a place to ground themselves during this pandemic. Everything just felt like I'm going through the motions. So that is in the youth area of where I saw impacts of COVID-19 in terms of mental health. And then as we go into adulthood, the general impacts that I was seeing for mental health was, again, this sense of what is purpose, what is motivation, what are we aiming towards? And when you have something like this, such as, which is where we're considering our mortality and our imminent mortality, like our facing the possibility of getting sick from something and dying, or possibly losing someone, we go into kind of a survival mode. We don't get to focus on what our future holds, or what we are, our legacies, or what we're trying to build as communities and as families. And we get sucked into just the day-to-day thoughts of, how do I stay safe? And we find this kind of mentality a lot in war zones. And that is why I believe this, metaphor of being in a war zone has been applied so much to the pandemic. And, we were mentioning frontline, that's a war term. We talk about post-trauma. We see that in veterans. The things that we're going through right now is similar to a war zone, because there is that fear of our own mortality. So these questions that put us into survival mode, and we're just stuck on, how do we survive through a pandemic? How does our family survive through a pandemic? There's only so much of that we can do before we burn out, or we become hopeless, or we become lost. When we don't have next steps or next goals, we can really become quite hopeless. And that was the kind of thing that I was seeing often in people of any faith, that they would talk about, like, when is this going to end? The uncertainty of it was an invisible burden that we were all carrying. So, I mean, it was a big question, Petra. I thank you for it. We can go into it more. later on, and I'm sure I'll talk about the effects of mental health on frontline later. But just to get the conversation going, there you go.
Thank you. That's extremely helpful. And you're right, like a lot of us could resonate with, or a lot of what you said is resonating with a lot of us right now. I'm going to switch a little bit to Dr. Ghada Khan to give us, a little bit more about, sorry. So as a public health practitioner and as someone who oversees an organization of Muslim health professionals, so frontline workers, those who are literally at the front line right now, can you tell us a little bit about what is the relationship between the public health, and I'm having a hard time reading. I am so sorry. Can you give us a relationship between public and health officials today? Can you share with us what kind of initiatives have taken place to address the pandemic, especially the health inequalities that were highlighted as a result of the pandemic? And then what do these initiatives mean for us as a community moving forward?
Thank you, Petra. Assalamu alaikum, everyone. I would like to share some slides actually with you. So I'm going to go ahead and do that. Bismillah. Let's start. First of all, before we start, I want to thank ISPU for including American Muslim health professionals in this very important discussion. And I'd like to acknowledge what the current situation is in our country when it comes to Corona. Currently, we have had 45 million cases of COVID in this country. About 6 million of them were among children. Well, 5.9 to be exact. And we have 700,000 people have passed away as a result of this disease. And our hearts go out to all those who've been impacted by it. And as both speakers before had mentioned, this has really impacted the country and the globe is in its entirety. And currently now we have 57% of the population that are vaccinated. And what can we do to do more? To your question, Petra, about what the relationship is between the public and health professionals, we know that public health in its nature is centered on the concept of social justice. And we can say that too with the medical profession, that it is centered on establishing the fundamental right to health among all human beings. And this aligns perfectly with the values of our faith, of mercy, of justice, and of the preservation of life. So as Muslim healthcare professionals, we're aligned with these values and the call in the Quran when Allah subhanahu wa ta'ala tells us, and whoever saves a life of one person, it's as if he saved all of humanity. Now, when we're talking about the situation here in this country, the experiences people might have with the health system say otherwise. Remember, our community is not a monolith. As Petra mentioned, we have varying levels of poverty within the community. We have different members of the community experience different disparities at different levels and racial injustices. And these racial injustices were definitely highlighted by COVID and perpetuated with COVID. And in order for us as a community to address these issues of equity, a holistic response was needed. And to your question then about what are the initiatives that were put in place, it was clear as a Muslim community that this response to COVID was coming as an organic thing. Muslims wanted to do something, but how do we do it with all these issues of mistrust, of a broken system, of health disparities, and with working from that faith perspective of empowering our communities and establishing social justice. There needed to be some coalition building. There needed to be dissemination of reliable information, and also empowering our community members to serve as ambassadors for the faith, but also for reliable information. And one initiative that I wanted to definitely highlight in this movement towards equity was the creation of the National Muslim Task Force on COVID-19, which started out with MHP and ISNA and Imana and the Fiqh Council of North America coming together to just start this process, but then it quickly grew into over 40 organizations that came together it was an interdisciplinary background. So we're talking about imams, community leaders, national Muslim advocacy organizations, health-focused organizations, all coming together to provide that guidance and evidence-based information and reliable information to each other and work together as a coalition to move this response forward. And the coalition also, the National Muslim Task Force also partnered with the National Black Muslim COVID Coalition, which was established by the Muslim Wellness Foundation and Muslim ARC, or the Muslim Anti-Racism Collaborative, because these responses, again, needed to be very targeted and very sensitive to all these issues that are facing our community. And the task force, along with the Black Muslim COVID Coalition, put together many statements and resources and guidelines to respond to this pandemic. We see that many mosques have shifted to provide, first of all, we needed guidance on how to close mosques, but as the mosques started opening again with the introduction of the vaccine, they started having to shift to providing vaccine clinics. We saw, as Petra mentioned, that Muslims were on the front line. Muslims as frontline workers needed that mental health support mechanisms that the presenter talked about earlier. But we see innovative ways of how Muslims responded to this pandemic. And again, this collaborative response that Muslims had to the pandemic definitely highlighted just the role of faith communities in general. And we're seeing that more and more as more evidence comes out. Studies have shown that almost a third or over a third of vaccine hesitant individuals actually would respond to faith-based initiatives in response to what would change their mind. Even vaccine-resistant individuals have when asked, would say that they would respond to faith-based initiatives. So again, this highlights the role that Muslims have in this area, but also faith in general. When we come together and are united through our values that are definitely coming naturally from our faith to do something, to have a response, then we can work together on this. And that's just a little snapshot, but I can talk more about AMP's initiatives and how we can move forward later on as we respond to questions.
Thank you so much, Ghada. And one thing that's really important to highlight about the National Task Force and initiatives like that is that we were learning as we were working, as we were doing and responding. ISPU was part of the initiative. And one of the reasons to collaborate with, one of the many reasons to collaborate, for example, with the National Black Muslim Coalition is because we were learning as we go as a community. And this is something that we talked about briefly. The response was so unprecedented. There have been a lot of attempts prior to do things like that, but the pandemic really push the community to engage in a different way than it has before, while also being vulnerable and admitting that we don't know everything about ourselves and others in our larger Muslim community. So we were learning together and growing together while responding and acting. And I think that was a really beautiful thing. I'm gonna move on to Dr. Sana. I know Dr. Muna mentioned or touched briefly on the impact on students in younger people. You're actually studying the impact of social distancing as a result of COVID-19 on the mental health of young adults. And you're co-leading a cross-national project to examine the impact of COVID-19 on graduate students. So I want you to touch or to give us a report or share with us how COVID-19 have impacted student population, whether it's their mental health or just learning or whatever else you could share. And what are some of the lessons that you're learning that can be helpful for our audience who are asking, how do we continue to engage with younger people, especially in a socially distant way?
Okay. Thank you so much. Assalamu alaikum. My name is Sana again. It is my pleasure and honor to be here, and I'm so grateful for the opportunity to highlight some of the information that we're speaking about today. So just to highlight, as Petra mentioned, I'm co-leading a few studies regarding the mental health impact of COVID-19 on young adult populations. So just to kind of highlight some of the things that we were finding, while we know obviously that social distancing measures have been deemed necessary to reduce the transmission of COVID-19, we also know that this can lead to significant psychological issues, such as depression, anxiety, and poor coping mechanisms such as substance use as well. So in our study, we surveyed over 650 young adults from New York, both Muslim and non-Muslim, from about July to October of 2020. So this was kind of really at the end of the first wave of the pandemic. And obviously being in New York, it was considered kind of the national epicenter of the disease at that point. So really kind of major impacts on nearly every person. And I think for most of us now in this room, obviously we can think of very real and impactful ways that COVID-19 have impacted each one of us. Certainly it could be in regards to work or family. It could be in regards to our livelihood. Young adults, however, are a special population. We know that COVID did not impact all populations in the same way. It has differentially impacted populations, as was highlighted prior, with different minority groups being impacted more than others, and with certain age groups being impacted more than others as well. Young adults are oftentimes seen as a otherwise healthy population, and therefore are at times overlooked when we think of health programming in general. However, previous disaster models and research has actually showed that oftentimes young adults are the ones that are most likely to have some severe impact and impairment after a disaster. And as such are more likely to really face some of the long-term health consequences that we might be concerned with. Some of the unique factors that make young adults at risk and have been at particular risk during COVID-19 is that the majority of them are single and therefore may not have as strong of a social support network in place. Along with that, they may not have as many access to significant psychosocial resources. And this could be, again, because of their financial status. It could also be because young people are less likely to have health insurance as well. So this kind of in combination with the COVID impact has put them at disproportionate risk for mental health conditions. Along with that, as everyone is aware of, both children and young adults obviously face the closure of their schools and their universities. Young adults were also more likely to face a loss of income. And obviously, I think, again, most of us know that young adults often turn to unhealthy coping mechanisms as well. So this is the age range where we see the highest rates of substance use, we see higher rates of suicide and other psychosocial concerns as well. So our study, again, which surveyed young adults from New York, showed that COVID-19 related depression and anxiety symptoms were extremely high for young adult populations across demographic categories. So just to give you a quick glimpse without getting too much into the numbers, amongst all our participants, we found that 36% had mild anxiety, 33% presented with moderate anxiety, and 10% showed that they had severe anxiety symptoms. So overall, again, with our population, 80% demonstrated that they had symptoms of anxiety. Similarly, we had very similar trends when we looked at depression. So about 29% of the population had mild depressive symptoms, 35% had moderate depressive symptoms, and about 16% showed moderate to severe depressive symptoms. So again, about 80% of the overall population showed symptoms for depression. So again, just really incredibly alarming numbers, especially when compared to mental health concerns of the adult population from studies prior. This is a marked increase, and again, across all categories. Another interesting thing that we found was that even though literature points to women being at the greatest risk for depression and anxiety, our study actually found that male participants reported slightly higher scores for both depression and anxiety. And I think this gets us to kind of think about the norms related to masculinity, some of the stressors that may have been unique to COVID, and some of the structural barriers that may be present when thinking about how people access care. Along with that, some of the factors that were related to some of these mental health concerns included having more severe impact from COVID. So people that had COVID or had more severe symptoms from COVID were more likely to have more serious mental health impact. Along with that, more having poor coping skills, having higher increased reports of loneliness, using alcohol, and having sleep disturbances were all linked to higher rates of depression and anxiety. Another thing that I think is really interesting is despite the high prevalence of anxiety and depression, really less than 10% of the participants ever had a diagnosis of either condition, and only about 20% of our population actually had received any sort of mental health care or treatment in the 3 months prior to the survey. So again, thinking about kind of the discordance and the discrepancy in what people's needs were and how they were able to access care and service is something that I think we have to think about moving forward. As I mentioned prior, coping is also a major issue of concern. So consistent with other studies, a large number of our population, about 54% of participants, reported an increase in alcohol use after stay-at-home orders were issued. So again, I think this data kind of shows the importance of examining mental health concerns and thinking of ways to mitigate the issue. My other study kind of also showed similar results and also showed the educational impact on young adults. So again, along with these stressors of COVID, there's obviously stressors related to education and not being kind of mentally there for the studies or not having adequate space in order to succeed in school as well. Again, I think thinking about this, it kind of begs us the question of looking at the larger US mental health system. Certainly this COVID has really shined a light on some of the inadequacies that are present. Obviously, thinking about the limited access to mental health services, including telehealth services, thinking about how different people have access to insurance coverage and whether mental health care is included in that. And then also thinking on a larger level in terms of the stigma that's attached to mental health as well. So it's, I think this really, again, shows the importance of strengthening our mental health system, and also stresses the importance of educating the population on these concerns as well. I think we know, obviously, sorry, go ahead.
Thank you so much. This is extremely helpful. And I know we'll touch on some of it during the Q&A section. It's just a lot of things to process. And I think some of us saw that in our everyday life, whether, you have frontline workers or children who are doing distance learning or others. So I think it resonates with a lot of us. And some of the questions that are coming in the Q&A box, I want to kind of switch to that segment now before we close with hopefully a hopeful note. So think of that as we're finishing up the conversation of what are the successes that happened during the last year and a half, and how we can how could we capitalize on them. So before we get to closing with that question, there are a few questions in the Q&A box, and I saw some answers from the panelists. But I want to see if anyone wants to add anything here. So a question is asking about, from a 13-year-old. So thank you for joining us. Do you know what effect the pandemic had on youth mental health? And Dr. Malik just touched on that, and we'll be happy to, once that report is out, to share it and host on our website. Linked it to her Scholar page, but we'll see here from Dr. Masood have responded to that as well in the beginning. Everything from isolation from peers and just not having connecting with people your age, to just the lack of social interaction, to understanding your identity, especially in those early years. And also part of that is the religious identity, the cultural identity, and so forth. So when you don't have that space to build that, there's a lot of questions. And we know from other research that American Muslim youth are already dealing with so many issues related to self-identity as a community that's extremely diverse, but also as a community that faces a lot of challenges, from discrimination, Islamophobia, and then just not seeing people who look like us represented in a positive light in everyday interactions. So to add to that, the pandemic and being isolated from our own communities or from people who might be our support network is an additional layer, unfortunately, for American Muslim youth. Anyone want to add anything to that? The second question, and I'm sure there might be more to add to that. So the second question was the statistics that show that women were more hesitant than Muslim men to get the vaccine. I know that's a topic. Definitely, I've seen it in my personal life with women that I know. Is the question is asking, do we know if it was related to pregnancy and lactation? From ISPU's research, we do not know exactly, because this is the first round of research that we're doing. We're hoping to have more follow-up questions that might touch on why certain things came out the way they are. But Dr. Khan answered here. Ghada, do you want to share your response to that? And if there's anything you want to add?
Sure. Again, a follow-up is needed, but just a reminder again about the period of time where the survey was fielded. And so at that time, the vaccine rollout was just happening, and there were still questions about the safety of the vaccine for pregnant and lactating women, which now has been established. It's been established that the vaccines are safe. Also, among other surveys that were fielded among the general population and other faith groups, responses from women were that the they were less likely to get the vaccine because of the added responsibilities they had and the lack of access. So they couldn't get, transportation, babysitting, childcare, or a time off from work, and so on. But also, as we saw with the rollout of the vaccine, there were many myths and misconceptions about vaccines causing infertility and so on. And these are, again, that misinformation is being addressed. And this statistic could be changed dramatically. So we need a follow-up, and we need follow-up questions to understand why this finding actually came about.
Thank you. One other question here is on what is looking for creative ideas on how to engage youth, especially, as a lot of things continue to be virtual. So I saw here from Dr. Masood, pretty much the summary is peer-led anything. Let youth organize for youth, lead book clubs, movies, game night, you name it. Dr. Malik, anything else that you want to add on to that question?
Yeah, no, I think that the peer-led community engaged methods are really the best way to go. When we see opportunities for youth to take positions of leadership, it oftentimes increases their involvement and engagement. And we know civic engagement is really protective against both loneliness and other mental health outcomes. Along with that, I think definitely faith-based interventions are particularly effective for the Muslim community. So thinking about how we can utilize faith in a positive way, because we know it's a way to connect people.
Thank you. And we actually see that too in our research related to making mosques more accessible to younger people. One of the ways you could make mosques more accessible to younger people is let them lead some of the initiatives, let them join the board, create that pipeline. So I guess it goes across the board of let youth lead the way for other youth. I want to give Dr. Masood a chance to talk a little bit about healthcare workers. I know they make they're a large size of the American Muslim community, and for a year and a half they've been at the front line, no break, no stop. So can you tell us a little bit again how that have impacted them and the health line that you created? And I want to share that ISPU is actually finalizing, a study on the mental health impact of Muslim healthcare workers. Hopefully the report will be coming out soon. So we just finished collecting the data and now in the analysis, and now we're doing the write-up. But I want to give Dr. Masood a chance to talk a little bit about that.
Sure, absolutely. What we've been noticing with frontline workers or healthcare workers throughout this pandemic is that, over time, that healthcare workers, though they have a very unique position in this pandemic, they are really the ones who are seeing the direct impact of this illness, including death and loss of life and families affected and all of that. We are also noticing that in the end, they are just as human as everybody else. And so the things that impact all the many topics we discussed today, when it comes to equity and social justice and all of the kind of cracks in the larger socioeconomic system of America, healthcare workers are also impacted by that as well. And that includes, equity in medicine, on how we take care of people of different socioeconomic strata, as well as racial inequities in medicine. Also, as being part of an advocate of mental health for physicians specifically and other healthcare workers, we have also learned from the people who call our support line that, that it was never just about COVID. They would call about all the things that we would be going through: election anxiety, about fears of, feeling very triggered as maybe as a Black physician during Black Lives Matter, and how, they were always, lessened and the work that they had to do to get to the places they have been. So we basically, the overarching lesson we've received throughout the work on the support line is that We were being called heroes, but we really we wanted to be seen as human. We wanted to be allowed and given permission to feel our own anxieties, our own grief, our own heartache, and our own processing of this pandemic, which a lot of us we did not feel like we could, because if we showed any cracks in our own strength, then, as leaders, what would that mean for all the people who are looking to us to solve this big problem? So we really, really struggled in that role that, we did not actually sign up for. And now, about a year and a half, we're starting to see a lot of compassion fatigue. We're seeing a lot of people who are very tired of healthcare workers losing their emotional connection to medicine, which is something that really is alarming, because you can't be in this field without an emotional connection. We need empathy to do the work that we do. And when we're losing that because of prolonged trauma of living through so much grief and heartache and death, and also, honestly, the vaccine hesitancy caused a lot of feelings of betrayal and a sense of hopelessness, even in us. All of those things, it's hard to bear. Like I was mentioning survival mode earlier, and how that's not sustainable. And that's what we worry. And I think physicians would agree with me, and I have gotten feedback that they agree with me, that we can't keep doing this for too long. We're already seeing people leave the profession. We're seeing people really getting detached. And though it's ending, I want to take, Petra, your words of that is there hope in this? And I want to leave people with hope. But though we're having all of these kind of feelings, I'll tell you, the people that I've been blessed to speak with, and my colleagues, my psychiatrist colleagues, have been blessed to speak with on the support line, even though they're talking about this, they're not really even giving up. They talk to us, they vent with us, they say, somebody just yelled in my face and cursed me out, but I'm getting it out with you so I can go back in there and do my work. And it's because that heart is still there. And I just want that to, that hopefully, and I say this with a lot of hope, that if the silver lining of this pandemic, if it can be empathy, if we can start seeing people as human beings, that we're not just, this is a doctor, this is this is that. If we're able to see the human behind all of the different roles that we play, perhaps we have a better future ahead of us. And I truly do believe that. And that's part of what being a psychiatrist is about, is hopefully instilling hope. So thank you.
That was
Thank you
beautiful. That was really beautiful, and a good way to transition to, give us hope. What is the biggest lesson, or what is the biggest thing that we have accomplished or learned about ourselves, or communities, our society? You have a minute and a half maximum to leave us hopeful. Sana, I'll start with you.
Yeah, no, I think Dr. Mona really summarized it really well. I think COVID has kind of, again, shined a light on some of the disparities that are present in our society, but I think it's also been a force that has unified people in ways that we didn't know were possible. I think we've utilized, again, new technology. We've relied on one another in new ways. And it's through that strength in our community, through even our personal connections, that we recognize that there's impact and there's ability to, again, strengthen what bonds we have in order to get through this together, right? I think we've heard that message that we're all in this together, and I think we want to ensure that we will all emerge from this together as well.
Thank you. Ghada?
I think there's, as I mentioned earlier, there's hope in our collaborations. And as both Dr. Sana and Dr. Muna mentioned, that there's hope in our unity and in our moving forward together. But there's also hope in the opportunity that is presented to start again, to build better, to listen better, to collaborate better, to just listen to each other and understand what's going on in our lives and what are the challenges that we're facing, and to learn from one another. And so I see much hope in the collaborations that have formed as a result. Again, interdisciplinary collaborations within our communities that haven't happened before, and they should be sustained. I think we can sustain this so that we're a community that's not reactionary, but just continues to do what they organically and naturally do as people of faith in that want the best for community members and want the best for humanity. So I see a lot of hope, and inshallah we can continue to work together on these great projects that everyone's putting forward, and we can move forward and establish health equity in our nation.
Thank you so much. Thank you, all of you, for just joining us and for leaving us with hope and for the work that you're doing. For our audience, we just launched a poll and we appreciate your feedback. Please let us know how this is helpful to you. And my note of hope is that I see more and more people use research, even if they don't, have never used it before, but to have their decisions be informed by research, especially about American Muslims. We've spent so many years guessing and pretending and allowing others to speak on our behalf and make wild assumptions. Today, we have a wealth of resources and information that tell us exactly who we are, what we believe. We might disagree with them, but this is what the research show. So let that be the basis of your decisions, of your conversation, and build on it. You don't have to waste time and resources to actually try to guess where Muslims stand on any issue. And always connect with us if you can't find anything. Whereas the panelists here could tell you, we're more than happy to talk with you and find a way to either provide the information or collaborate with you. Again, I want to thank everyone that joined us today and remind you we have 2 more webinars that are coming up. One next week, Thursday at 3, that will be focused on substance abuse in the American Muslim community and whether American Muslims believe there is enough support for those who are struggling. Again, brand new data. And then Tuesday, November 2nd, yes, I know, election day for a lot of people, but it is what it is. We have a webinar that will focus on centering the voices and the experience of American Muslims with disabilities. And again, whether the community believe there is enough support for those individuals. So really important topics that are coming up. We will follow up this webinar with an email that contains the recording and more resources and information. And again, I want to thank you all for joining us today and have a good evening.
Thank you, everyone.
Thank you, everyone, for having me.